Welcome to North Tees and Hartlepool Voices, telling the stories of our people and community in our trust.
In the studio today we have Vanessa, Emma and Trevelyan from the Specialist Palliative Care Service. Can you tell us about the Dying Matters Week?
Yeah, so Dying Matters is an event which runs nationally next week from the 6th to the 10th of May. This year's focus is based around the language we use to talk about death, dying and grief. Here at North Tees and Hartlepool Trust, the Specialist Palliative Care team have several events running to promote this, including a barrow which will be located at the back of the Tees canteen, which will be manned daily from 10 a.m. till 2 p.m. There will be lots of information, leaflets and books to open up throughout the conversations around death and dying. The Melissa bus will also be visiting North Tees on Wednesday the 8th of May, 10 till 3, and Hartlepool on the 10th of May, 10 till 3. This is focused on community staff access and is done by appointment only. Again, these can be booked through the palliative care team. If people are interested, they are 1 hourly slots, which will be running on both days. There will be interactive games, information and leaflets, much like the barrow. There is also the Schwartz round running that week, which focuses on Wish You Were Here. These can be accessed at the Spirituality Centre in North Tees on May 9th and Hartlepool on May 16th.
What is the palliative care and the end-of-life care?
Palliative care aims to achieve the best possible quality of life for patients who have been diagnosed with an illness that cannot be cured. It's about ensuring that a person's dignity and comfort is promoted and respected at the end of their life. And end-of-life care focuses on the things that matter most to a patient, their family and loved ones, friends and carers. This could be spiritually, emotionally or physically.
So what is the specialist palliative care then?
The specialist palliative care is provided by a team of professionals. They have the extra training and experience in palliative care. So where the kind of health professionals that provide the generalist palliative care are struggling, we often step in. So the likes of the GP district nurses, if there's extra advice or support needed, that's when we get involved. We're quite lucky insofar as that we have consultants in our team, and that the local hospice is a specialist palliative care unit because it has that consultant representation.
And who are the team and what do you actually offer?
So the team are made up of, as I've already mentioned, consultants in palliative medicine. We have quite an extensive team of clinical nurse specialists that a lot of them have prescribing qualifications. We have therapies, including physiotherapists, occupational therapists and the therapy technicians. We have access to chaplaincy, psychology and also the local hospices. What we offer is a specialist assessment for people. So we kind of give expert advice on helping to control symptoms such as pain. So where people are struggling, often we step in. We don't take over people's care, but we can step in and give advice on how to manage complex symptoms.
So how do you contact the team or refer to the team?
So the team can be contacted as part of a limited 7-day service. The team can be reached by contacting us through the Vasira and asking for palliative care. This can be done 9 a.m. to 5 p.m. Monday to Friday. Outside of the 9 a.m. 5 p.m. hours, the on-call palliative care consultant can be reached for telephone advice by contacting switchboard and asking to speak to the on-call palliative care consultant. There is also limited support available on Saturdays, Sundays and bank holidays via the Vasira 9 till 5. Patients, families and carers can contact the palliative care team by contacting the single point of access on 01429 522 500 and asking for specialist palliative care. A member of the team will aim to respond to calls as soon as possible. And just so that everybody is aware, the team are based at Farndale House, which is on site here at North Tees Hospital.
And what educational involvement do the team have?
We have quite a lot of educational involvement, and this is just a sample of a few things. So we have produced some education boards that go onto the acute wards. We are teaching district nurses through their PCN networks. We're involved with delivering SIM training, Sage and Time communication training. We also have many students that come to the team, and we also have members of the team that deliver education by lecturing at university. And of course we have medical training programs involving GPs, F1s, 2s and registrars.
How do SPC get involved with research and national guidance and within audits?
We have an active quality improvement and research group. Some of the ongoing products, which I just pulled out to speak about today, we're seeking to improve the experience of families where we have patients at end of life in hospital. We're looking to improve information sharing across teams. We're also involved in research. Primarily it's at the moment one of our consultants who does a lot of research is involved involved in a project looking at palliative care and mesothelioma. We also have 2 team members doing PhDs, doing their doctorates. And it's worth mentioning that in early this year, in early 2024, we were awarded as a team the Dundas Medal from the Royal College of Surgeons, and that was for improvements in provision of hospital palliative care.
So whereabouts do you see the patients?
Well, we realise that each person that we come into contact with has quite different needs. So we have an acute team that sees patients in the hospital when they're admitted, and then we also have a community team that see people in their own homes. There's also the choices of patients that we've seen come into clinic on a Wednesday, or we see people in the hospices if they've been admitted, or the therapists run clinics in the hospices as well. So we are quite a versatile service.
So once again, how do people get in touch with the team?
So the team can be contacted as part of a limited 7-day service. The team can be reached by contacting us through the Visera and asking for palliative care. This can be done 9 a.m. to 5 p.m. Monday to Friday. Outside of the 9 a.m. 5 p.m. hours, the on-call palliative care consultant can be reached for telephone advice by contacting Switchboard and asking to speak to the on-call palliative care consultant.
Thank you for joining us. Till next time, you've been listening to NTH Voices.